This segment is sponsored in part by One Brooklyn Health.
August is Breastfeeding Awareness Month, and One Brooklyn Health is on a mission to support new moms on their nursing journey. Here to help us understand what new moms need to know is family nurse practitioner and lactation consultant Ashley Orenshteyn. Welcome, good to have you here.
Thanks for having me.
So let's start off, Ashley. How does One Brooklyn Health approach new moms when it comes to just educating them about nursing?
Well, overall at OBH, One Brookdale Health, we ensure that we follow the 10 steps of successful breastfeeding, which is pretty much the gold standard of best practice for facilities that provide maternal child care. And we've become so great at it that we were officially designated Baby Friendly in 2022 by Baby Friendly U.S.A, which is recognized by the World Health Organization.
That's great.
Yeah.
That's great. You know, we hear so much about how good it is for babies to nurse. Can you talk a little bit about some of the benefits of breastfeeding your baby for the babies?
So some of the benefits is it provides live immunity, and live immunity in such antibodies that decrease the risk of acute illnesses as well as chronic illnesses. Some of these illnesses include upper respiratory infections, diarrhea, middle ear infections, and SIDS. SIDS stands for Sudden Infant Death Syndrome. So according to the American Academy of Pediatrics, it's recommended to exclusively breastfeed for 6 months and continue to breastfeed up to 2 years or more. Now, if a mom or family chooses to breastfeed their baby for just 2 months, it decreases the SIDS rate by half, by 50%.
Wow.
Yes.
That's a stunning statistic. You know, when my wife was nursing our kids, she just kind of let them decide when they were done nursing, right? When they were ready to move on. Is that sort of what's anticipated, that you go as long as the baby wants to nurse?
Yes, that's correct. So each individual is unique, and some families, they may want to nurse their baby for longer periods of time, and it has so many benefits for both mom and baby.
What are some of the long-term benefits of a mom nursing her baby for the baby?
So some of the long-term benefits is allergies, asthma, obesity, and diabetes.
So they're lower rates?
Yes.
Of those things for babies who've been nursed for longer term?
Yep.
Wow. But it's also not just the babies that benefits from this, and this is something I find really fascinating. The moms benefit as well. Can you talk about some of the benefits for the moms?
Yes. So when it comes to the mom, it decreases the risk of osteoporosis, decreases the risk of some breast cancers, ovarian cancer, and that hormone that is excreted during nursing, oxytocin, that hormone, it helps and involutes the uterus, bring it back to its pre-pregnancy size, which decreases postpartum hemorrhage, as well as improve cardiovascular health as well.
Wow. And also there's some mental health benefits as well for moms, yeah?
Yeah, so mental health benefits for mom and baby. So breastfeeding for baby in general, it increases, it prevents insecure. So it creates secure attachment. Just the closeness alone of being in your mom's arms it benefits the baby's health. And in regards to the mother, decreases the risk of postpartum depression, and it saves money, which is definitely helpful when you're trying to breastfeed. You don't have to worry about spending any money on purchasing.
I gotta say, saving money is good for my mental health.
Yes.
For sure, it is. You know, I know that my wife nursed 2 babies, and it was a really different experience. One was much easier than the other, and I know that a lot of women struggle with nursing. What kind of support does One Brooklyn Health offer for moms who might be struggling a little bit?
Okay, so as I said, we follow the 10 steps of successful breastfeeding. So what we do with our families is that we educate them, right? Because, you know, there's an abundance of amount of scientific evidence that shows that breastfeeding promotes the best health outcomes for both mom and baby. So we make sure we educate our families this information so they'll be more informed to make an informed decision. And we do that prenatally. And preparing the mother, preparing the father creates more benefits in the sense where now they have the tools.
Yeah.
Then we also have them do skin to skin, right? And skin to skin is where the primitive reflex come up with the baby, and it gives the mother more confidence, right? We ensure that our families get breast pumps. It's covered by most insurance companies, and we show them hand expression because that can help with engorgement, also give confidence. And for our moms that may have challenges initially, we provide donor human milk with the mother's consent, and that helps with, decreasing for premature babies, most likely for what we use it for. And when it comes to our staff, all of our staff, they're educated how to provide basic latching and position, and lactation specialists as myself. We help with the more complex breastfeeding.
Sure, that's great. Ashley, thank you so much. Such good, important information. If you are a new mom, or if you know one, you want to get more information about breastfeeding, scan that QR code on your screen or visit Pix11.com and click on the Pix Partners tab. Dan.